Hi, good afternoon, everybody. My name is Vanessa Pimentel. Have you guys ever wondered why, when people go to the doctor, like they're bilingual? There's bilingual secretaries there, but sometimes in some doctor offices there isn't. And like my mother, for example, I'm Dominican. She came from Dominican Republic. She asks me to go to the doctor with her because she doesn't know how to speak Spanish that well. So every time I go with her, she always needs me there to translate. So if people like secretaries and doctors were more bilingual in doctor offices, it would be more beneficial to people who can't speak English. Today I will be talking about the main issues, how it affects Latinos, and how it can be solved. Some problems that Latinos face is that majority of the Latinas who live in New York and California are going to doctors for the wrong reasons. Most women who are Latina have been diagnosed with cancer without even knowing it. In this article on LifeScript.com, it talks about how when Latinos go in for checkups and they have communication problems and tend to feel nervous and scared when they approach the doctor. Also said in this article, Heather Oram, whom studies racial disparities in cancer at the University at Buffalo, has been doing some research on why Latinos do not get proper checkups. She said it seems very plausible that it is not happening for Latinos because of access barriers and language barriers. This problem affects these people's health. Not only women with cancer is a problem, but also Latinos are not getting tested for HIV. In this article from KATV.com, in Arkansas, on October 15, 2011, there was an event especially for Latinos. At the end of 2010, there was a total of 7,293 cases of HIV, and 3.3 reported that they were Hispanic. This event was held for Hispanics because of Hispanic Heritage Month, which is this month, and for the benefit to get tested. In the article it said, limited access to prevention and care, cultural barriers, language barriers, and immigration status continues to contribute to this disparity. The executive director of Arkansas Minority Health Commission, Idiona Trotter, wants to prevent Latinos from getting HIV and organize awareness programs. There are people out there willing to help the Latino community. Guillermo Chacon is the president of the Latino Commission on AIDS. And in this article he stated, recognizing that our communities have faced persistent barriers to accessing health care and HIV services, and we all need to come together to reaffirm our commitment to increase HIV and AIDS awareness in all Latino Hispanic communities. Not only Hispanics need this help, but also other cultures as well. When I went with my mother to the doctor last week, I asked one of the secretaries, who is African American, like how they feel when they get approached by a Hispanic person or other cultures, like, you know, they don't have any help. So she said that they are working on it to get more people who are bilingual or even trilingual to help, you know, patients there because they need that help. In doctor offices, they need more bilingual secretaries and doctors to help those in need. With that help, more Latinos will be cured from any illness that they're facing. In this case, HIV will be prevented and they will be aware if they have cancer or not. Thank you.